Roughly 50 years ago, humanity was in the blinds on the solution to infertility, despite trials to achieving conception, with and without the aid of science, which eventually came through. At England in 1978, to be precise, it was acclaimed that the first live birth, test tube baby, was Louise Brown. And here at Androcare Fertility Centre, we make babies come true. Gone are the days where women alone were discriminated as the sole cause of infertility in their homes. Now, there's awareness and accessibility to screening both partners for detecting the origin cause. Infertility can be defined as the inability to conceive despite having carefully timed and unprotected sex for 1 year. Around 1 in 6 of the adult population worldwide experience infertility. Not to worry, the solution is here. Androcare Fertility Centre. Androcare Fertility Centre has been up and running for a minimum period of 5 years and with many more years to conquer. In our years of effecting change, what keeps us going are client testimonies. Here, we refer to them as clients and not patients, removing any form of stigmatization. For clarity, stick with me as we journey into understanding the goal, mission, and vision of Androcare Fertility Centre.
I am Dr. Daramola Adeleke, the Clinical Director of Androcare Fertility Centre. I am a reproductive medicine specialist. I have been in the field of infertility treatment for the past 10 years. And over the years, God has blessed us with several pregnancy test results and lots of babies. We are here to give you all you need. We are known for 3 things: empathy, integrity, and quality services. We work hand in hand to give you the best experience ever. We have doctors, gynecologists, andrologists, and embryologists who will work as a team to give you the best experience ever. You are welcome.
As Androcare Fertility Manager, we ensure you have a good experience here in Androcare Fertility Centre, together with myself and my team, which are the doctors, the nurses, embryologists, and every member of Androcare staff. We ensure you have a great experience here in Androcare. We journey with you in this particular race together. We pray along and give you every details you need in this treatment. We also look for you even at the stage of pregnancy. When you give birth, we look for you during the dedication to come and wow with you, to celebrate and rejoice with you with your baby. We come send gifts. Even at the stage of pregnancy, once your test is done, we all gather together here to celebrate you. We cut cake and eat rice on your behalf just because we rejoice with you. Our aim purpose here in Androcare is because we care for our clients with integrity, and we want you to have a great experience here in Androcare.
Hello, I am Lola by name, and here is my colleague Jane. Together, we are the face of Androcare.
Here in Androcare, we welcome our clients with warm reception into our cozy environment, providing them with refreshments that they can take, and also we have some leaflets and magazines that they can go through before they have been attended to.
Here in Androcare Fertility Centre, our ultimate goal is to reduce our clients' waiting time as much as possible. We want to ensure all our clients have a wonderful experience here. At the end of the day, we want to see smiles in the faces of our clients and see them happy when they are living here with their testimony.
You are welcome to the client liaison department. This is the department where we attend to clients that are coming in for the first time to make inquiries about our services, and especially clients that are trying to go into assisted reproduction technique, trying to assist them in achieving conception. Now, when they come in, we give detailed information. Now, this information are necessary because it's a big project going into assisted reproduction technique like IVF or IUI, and it's a project that needs to we need to plan, because for any project you need to plan ahead, and that is why we give this information to be able to help our clients to be able to plan properly before embarking on the journey of the IVF or any of the options that is available or applicable to them. Now, giving that information will help them, number one, it will help them to plan financially, because if they don't plan financially, they may get stuck along the way. Also, it will help them to prepare psychologically and emotionally, because this journey can be a bit stressful emotionally. However, Androcare is ever there, right from the beginning, to support you all through emotionally and psychologically. But at the same time, they need to have that information so that in the course of the treatment, it's when if stress coming, they can know how to manage it. And also, we give this information to help our clients to plan their work schedule, their business schedule, so that one will not affect the other. So when our clients are ready to start the process, the first thing we do is to take their registration. The registration involves taking their personal details. And one of this is to take their full name, is to take their real age. We always encourage our clients to give us correct date of birth. Also, we take gynecological history, like their menstrual cycle history. We take history of if they've had surgery before, if they've gone through this journey before. All this information are vital and important to us because it helps our doctors to be able to plan their treatment. Every information matters, and that is why we always encourage our clients to give us real and correct information. And finally, what we do in the department is to follow up our clients, and that is why from day one we give out our phone numbers for them to call for any reason, for support, for clarification of any sort, especially booking of appointments, so that we don't keep them waiting at any point in time. So like I mentioned earlier on, Androcare is there to support our clients right from day one. So we check on them for well-being, for support at every time. So in all of this, I tell you, Androcare is the best place you can come for your assisted reproduction technique. Right from day one, we give you your support. We are there to encourage you, to give you the right information you will need in the journey to success.
I'm matron, fertility nurse, Androcare. In Androcare, we understand that infertility journey is an overwhelming journey, and we understand what our clients are going through. So in Androcare, when a client is registered, a nurse is attached, a fertility nurse is attached to her, who will take her through the ups and downs of this infertility journey. We are there to support, to educate them, to hold their hands, to support them emotionally, to ensure that we make this stressful journey easy for them. And at the end of the day, we all rejoice at her success, at achieving her goal for coming to Androcare.
We are client-focused here and are passionate about helping build families today for a fulfilled tomorrow in our fertility center.
Your health is paramount to us here at Androcare Fertility, which is why after we get your folder from the front desk officers, we go ahead to check your vitals, which includes your blood pressure, your pulse, and for the woman, we also check her weight and her height. This is to help us to calculate our BMI, and we are doing this to ensure that we know your health status, as this is very important for us to get to achieve your IVF treatment. After all of this is done, we go ahead and take the folder to the doctor's office where they will be sent next.
I'll be talking about consultation. Consultation is the first stage or first visit by a client to know their fertility status, reproductive or sexual state, and also screening. After clients have seen the nurses for their vitals, they come for consultation where we take information about their history, gynecological history, and obstetric history. Then they are booked for screening, either basic fertility screening or IVF screening, depending on the consultation and also their history. Basic fertility screening involves seminal fluid analysis, hormonal profile, HSG, viral markers, and serology, whilst IVF screening involves AMH, sonohysterogram, SFA, that is seminal fluid analysis, viral markers, and serology. After screening, results are collected and couples are booked for review of their results.
When you are going for IVF, there are two stages, the pre-treatment stage and the IVF cycle proper. In the pre-treatment stage, that's where we have the IVF screening. It is very important you do this screening, because without this screening, we would not know the criteria needed for you to get pregnant with IVF. This screening is very important. You can't just call and say you want to do IVF tomorrow. It's not magic. You can't get pregnant easily like that. So you need to meet the criteria for having a successful IVF. What are these criteria? We check the sperm, we check the egg, we check the womb. We check your blood tests, we check your health status before we go ahead. If anything is wrong, it can affect the outcome of IVF. So it's important you do your IVF screening. We normally do our screenings every Thursdays and sometimes Saturday. When this day comes, you have to be relaxed because we need to check your vital signs, check everything needed for us to make you pregnant.
On our screening days, staffs are usually very busy at the clinic, but we try our best to properly manage our clients' waiting time and also reassuring them on their best interests being our goal.
My role here as a medical scientist in Androcare Fertility is to analyze testing in areas such as hematology, microbiology, coagulation, serology, and immunoassay. All these are to help the physician to generate and assist them in confirming the results. Every Thursday is always our screening day at our clinic here, both for walk-in patients and referral clients. Once the nurses are done with the couple, they take them to the phlebotomy section. At the phlebotomy section, that is where the blood sample is being collected. I make sure I make them feel relaxed and comfortable as at the time of collecting the blood sample. Once I'm able to see a visible vein, I use a wet swab to clean the surface of the vein, use a tourniquet to tighten the area. The essence of using this tourniquet is to make it prominent and for the flow of blood to come out well. As at the time of collecting this blood, the blood is being poured in appropriate bottles to analyze the several tests being done. We run full blood count, blood group and genotype, their viral loads, blood glucose, their immunoassay, and urinalysis. Before this urinalysis is being done, a bottle will be given to the wife to produce a midstream urine. The essence of doing this is for us to check for the chemical composition of bacterial infection in the woman. Once all this is being done, the analysis is being carried out in the laboratory. Within 24 hours, the results will be ready and be uploaded on the client's portal for them to view. The essence of us doing all this is for IVF treatment and IVF cycle.
So on our screening day, we're going to take your vital sign. And we're also going to do a sono for you. So a sono is a procedure that is done to gain access into the womb and to also detect for any form of pathology. So I just want you to be calm during the procedure. It's not going to be painful. If you have done HSG before, the pain is nothing compared to that. So I need you to be fine and be calm.
I'll be talking on sonohysterogram, otherwise known as SHG. It is a primary diagnostic procedure to evaluate the womb and also prior to ART, that is assisted reproductive technique. The sono helps in evaluating or to evaluate the uterine or womb abnormalities such as submucous fibroid, polyp, and intrauterine adhesion. The main focus is for us to know the accessibility of the cervix, when to drop or where to drop the embryos, and also how the womb can be distended. It is easy, it is cost effective, and easy to perform and safe. Patients sign consent prior to onset or beginning the sono. When do we do sono? Sono is done after we've taken the menstrual cycle, that is after menstrual flow, and also we scan to be sure that client is not pregnant. When indicated or when not indicated, analgesic or sedatives is not necessary. How to perform sonohysterogram or SHG? First, the client is asked to lie in a dorsal lithotomy position, that is, to lie on her back. A consent form is taken. Then, as you can see, I'm putting on my personal protective equipment, my gown, my cap, my face mask, and my goggle to protect me from infection. Then, I pick up my transvaginal ultrasound probe or TVS probe to scan the client and ensure that she is not pregnant. Thereafter, I pick up my speculum, which I lubricate with a gel to have easy accessibility to the cervix. Cervix is like a window that gives us an access into the womb. Then I pick up a sono catheter. I insert the sono catheter through the cervix to dilate the womb, and I pick up this injection which contains physiological normal saline, which I infuse or inject slowly to dilate the cervix. Dilation of the cervix is done slowly so as to prevent abrupt distension of the womb and also to not cause pain for the client. Sonohysterogram lasts between 15 to 30 minutes. It's not painful. Don't be scared.
Review of results. Once you are done with your IVF screenings, whereby they check the quality of your eggs, the quality of your sperm, and the integrity of your womb, they give me all these information for me to interpret and have a review with you. This is the most important stage in this IVF cycle, because without a review, this can affect the outcome of the IVF cycle. We will be discussing everything that entails the IVF cycle, the challenges that can be faced, and also how best we can achieve success. We screen the sperm, we screen the eggs, and we also screen the womb. These three things can determine the success of your IVF cycle. If the sperm count or the sperm quality is not okay, I would need to prescribe some medications to improve the quality of the sperm and probably book the best month for you to start your IVF cycle. The same thing goes for if the egg is poor. If the quality of the egg is poor, then I might need to put you on some supplements, modify your lifestyle, or probably advise on the use of donor egg. And we now agree on a date to start the IVF cycle. Or sometimes if the womb is not too good, probably I saw an endometrial polyp, or I saw a submucous fibroid, or there were adhesions in your uterine cavity, then we might need to clean it up before we start the IVF cycle. We should have a discussion, an agreement as to the best option to choose. I myself will provide the best options for you, but it's always left for you to tell me what you want, because I know sometimes you might say, no donor egg, no surrogacy, no donor sperm. Well, fine, I'm not God though, but I prefer the best solution, because from my experience, I realized in IVF, once you focus on the best option available, the chances of a successful IVF is very, very high. So after this is done, we agree on the dates. Probably, for example, today is May. You can tell me you want to do your IVF in June or July. So it is important, before you start your IVF cycle, you must have the review of the results with your fertility doctor. That is the best way to get pregnant fast with IVF.
As we all know, or may not know, there are 3 factors that affect the success of IVF. These factors are good womb, good sperm, and quality eggs. At the point of review with the doctor, if any of this is lacking, the doctor mentions or introduces you to the third-party IVF, which is in form of a donor egg, donor sperm, or surrogacy, as the case may be. Today I will be talking to us about egg donation, donor egg. Who are egg donors? Egg donors are brave young girls who have voluntarily and willingly brought out themselves to donate their eggs to to help you, the mothers, achieve the dream of a child. How do we get these donors? We don't just pick these girls from the tree. They are not fruits we pluck from the tree. We get them from registered agencies. When they send this girl in, we make them go through our criteria to make sure they are fit to donate. What are these criteria? We'll look at their age, which should be between 21 to 29 years. We look at their BMI. They shouldn't be too big. It should be between 19 to 24 kg per meter square. We'll look at their genotype. At this point, we assess them even physically and mentally. They have to be healthy physically and also mentally sound. We look at their educational background to be sure they are sound also. They must have an excellent family background. We look at all this. Then we proceed to the point where we check for if there is any abnormalities with their reproductive organs. That's why when they come in, we take them for scan to check that their ovaries are intact. A donor must have 2 ovaries in her reproductive organ. Apart from that, we also take their blood to check for infectious diseases, to be sure they are free of infections. For us to consider a donor, the donor must have a genotype AA. So there are so many of them that come in. They are very fertile. But the fact that they are AS disqualifies them. They can't help even when they want to. So when we make them go through these criteria and they are fit, they are qualified to be a donor, then we'll bring in the client's preferences into perspective. We start the process of pairing. At this point, we pair the donor to the client according to what the client's preference is. This process will take about a month or 2. These are the process we make them go through so that we make sure we're giving you the best. When we pair these clients with the donors, we want the client and the donor to bleed around the same time. As you're going through your own treatment, priming your womb, the donors are taking injections for your sake. The process of egg donation is not easy. It's actually tasking. We don't pay egg donors. We only compensate them for their time and for the stress they go through, visiting the clinic daily just to help a woman or a couple achieve their dream of a child. Also, we have the donor sperm. This donor sperm comes into play when the man, at the point of review, if the doctor discovers that the husband of the couple coming for IVF, the sperm is not very optimal and would need assistance from a young guy, we would also bring in a donor sperm. That's also a third party. In a case where the woman is unable to carry her baby herself, she will need the services of a surrogate mother. A surrogate mother must be a mother, meaning she must have had a child. Surrogacy IVF, we do here in Androcare, but we also get these surrogates from registered agencies. They must be between the ages of 21 also to 35. They must be free of infectious diseases, so we screen them to be sure they don't have any of this. Their genotype is not important because the child does not carry their gene. They only bring their womb for the baby to grow in. We take the surrogate to the theater to check for any abnormality in her womb, as against what we do for the donors. The donors were concentrating on their ovaries, while the surrogates were interested in their womb, their uterus. We do a procedure called the sonohysterogram on their uterus to rule out for any pathological effects. When we are sure the surrogate is free of anything that would hinder the implantation of a child or that would be a problem for the baby to implant, the surrogate gets disqualified. So we make them go through this process just for what? To give you the best, to make sure you're getting the best of the donor egg, the best of the surrogates, the best of the donor sperm. Controlled ovarian stimulation is a process that involves moderately stimulating the ovaries to produce multiple eggs as compared to natural cycle where just one egg is released during ovulation. During controlled ovarian stimulation, there are series of ultrasound scanning to monitor the ovaries, and also gives room for adjustment of medications. Stimulation takes about 9 to 12 days, and this is specific to individual basis because some people requires enough time while some might require less time to respond. The common drugs used for ovarian stimulation are the follicle stimulating hormone, the human menopausal gonadotropin, centrotide, and the human chorionic gonadotropin. All these drugs have their specific roles in producing eggs and maturing them for IVF use. Traditionally, there are two major IVF protocols during the stimulation, the agonist and the antagonist protocol. The agonist protocol is further subdivided into the short and long protocol, with the former not really used these days. The commonly used protocol in Androcare here is the antagonist protocol, which is seamless, cost-effective, easy to handle by the client, and also yields good outcome. There are two types of IVF cycle, the own cycle and the recipient cycle. In the own cycle, it clearly means the client uses her own egg to achieve pregnancy. The recipient cycle involves synchronizing a donor's period with the woman's menses, because we are trying to get eggs from the donor to aid pregnancy for the recipient. In such cases, instead of stimulating the woman's ovary, we give medications to suppress them and give some hormonal tablets such as estrogen to build the endometrium as plans towards the transfer of the embryo.
The woman is taken into the recovery room where she's given a gown to change into. A line is set for her because most of the drugs will be given intravenously. Also, the procedure is explained to her because that it takes about 10 to 15 minutes depending on the number of follicles that she has. After which she's asked to urinate herself because we need the bladders to be empty. Also, she'll be given a consent form which entails most of the information about the procedure. Then she's taken to the theater, she's positioned in the lithotomy position, and then every vital signs will be taken. We assist the doctors by connecting the oocyte needle to the suction tubes, after which the aspirates are then sent to the lab for fertilization. Also, we ensure that we monitor the client's vitals regularly during the procedure to ensure that they do not aspirate. After the procedure is done, we assist the clients back into the recovery room where they are monitored until they are stable. Later on, the clients will be called to give them the outcome of the fertilization and also be booked for their next appointment, which is usually embryo transfer.
The oocyte pickup, also known as egg collection or egg retrieval, is a sterile procedure carried out here in the theater. This could last between 10 to 30 minutes, and this depends on the complexity of the procedure or the number of follicles. At this point, anxiety tends to build up in anticipation for good number of eggs. On the day of egg collection, an informed consent is obtained from the client, and they are also advised to abstain from food nor drink at least 6 hours before the procedure commences. They are also encouraged to refrain from the use of strong deodorants, perfumes, or makeup, as this impacts negatively on the oocyte. She is placed in lithotomy position and her vital signs are checked. In fact, abnormal vital signs such as low or high blood pressure, abnormal pulse rate, they are cogent reasons to cancel an already planned egg collection. The client is given some medications to allay anxiety and sedate them consciously to enable them to be cooperative during the procedure. The vaginal wall is cleaned with gauze and normal saline to prevent introduction of infection to the pelvic cavity. The oocyte needle is attached to the transvaginal probe to ensure visualization of the ovaries through the vaginal wall. And with every prick, a needle is introduced to the ovary, to the follicle, to suck out the follicular fluid, which of course contains the oocyte. Oocyte pickup requires expertise and accuracy to avoid injury or failure of the procedure, and also to maximize the chances of the IVF. The aspirated follicle is collected into a collecting tube, which is attached to a suction machine, and it has a pressure of about 120 to 140 millimeter mercury, which should be maintained. High or low pressure affects the quality of the eggs. Our clients' well-being are our utmost priority. To that regard, their vital signs are monitored all through the procedure and even after. Following the aspiration of all follicles, the aspirate is handed over to the embryologist to sort. This is a very interesting part of the treatment because everybody comes in handy and everybody contributes to the process. And we also tend to appreciate life at that microscopic level. After the procedure, the client is scanned to ensure there are no form of injuries to the bladder, no form of bleeding or even bowel perforation in severe cases. They are taken to the room to rest for a while. They are also given medications such as antibiotics to prevent infection, analgesic to reduce the pain from the traumatic process, and also IV fluids.
Did you know that the human egg, sperm, and embryos are not visible to the naked eye except with the use of a microscope? Did you also know that the human egg is 20 times the size of a sperm? Well, here at Androcare Fertility Centre, we have a standard embryology laboratory comprising of everything you need for a good and successful outcome. We have the consumables, the equipment, the laboratory as a whole, and obviously the embryologist. Gone are the days when you can't preserve your egg or your sperm. Here at Androcare Fertility Centre, you can freeze your egg and you can freeze your sperm for future treatment.
When we start the egg retrieval is a procedure where the fluid is taken from the woman and sent to us to the lab to search for the eggs. Now when the eggs are identified, they are moved into a different dish. Now from that dish, we know if we're going to do normal IVF or we're going to do the ICSI. In the case where we are doing the ICSI is simply picking a sperm cell and injecting it directly into the egg. Now when that is done, we move them into the incubators and we culture them for 3 or 5 days, depending on when the transfer is going to be done. So after 5 days of culturing, we discuss with the doctors on the transfer, and then the patient is prepared for the transfer. So what we do here is very taxing. The procedure is not just putting one and one together and expecting everything to go well. Sometimes you spend a whole lot of hours here, and then after doing all that, you still keep praying that everything goes well. Despite all the challenges and all the difficulties of doing all this, we always make sure we put in everything humanly possible to make sure you get the best result. And no matter what happens, just make sure you understand that we have your back.
To increase or ascertain a higher chance of implantation, PGD can be done. PGD is also done to reduce the risk of passing on inherited condition from parent to offspring.
The point to consider when coming in for PGT is to know that PGT can only be done with IVF. You cannot do PGT without IVF. The first thing we do when you come for PGT, you'll be given some fertility drugs to help you to produce more eggs that you will normally have produced. Now we harvest those eggs on a particular date and ask your husband to come on that same day. He produces a semen sample. We use the semen sample to fertilize the egg and we generate what we call embryo. Now we culture these embryos between around for like 5 days. We take the sample or biopsy from each of these embryo. If we take it on day 3, the sample or the biopsy is called a blastoma. If we take it on day 5, it's called a trophectoderm. These samples are taken to the lab and we analyze it with the machine to check genetic status of the embryo. What we use at Androcare is called MySeq. So the result of the test will determine which embryo is healthy or which is affected. And then the desired embryo is returned back to the womb and the process is complete. The benefit of pre-implantation genetic testing is to help us select those embryos that are truly healthy from the one we assume to be healthy. In IVF, what we generate are embryos, and the maximum they stay outside the incubator is 5 days, and there's supposed to be blastocysts on those days. Based on our grading system, we can tell if the embryo is good morphologically. But there are things we can never tell. Is what makes up the embryo genetically. So PGD testing will tell us the whether the genetic makeup of those embryo can be considered to be the one that will be said to be healthy or not. Unlike an IVF without PGT, which we rely on the morphologically grading, which is very subjective and cannot tell us the genetic makeup of the embryo. Now, in people women that are above 35 years of age, the frequency or the incidence of aneuploidy greatly increase from that point. So they need to know that the embryo that we are transferring to them are truly healthy or not. Now, you'll find out that in some cases of infertility, the cause of infertility will be described as unexplained. Unexplained means that we do not know the cause of the infertility. Testing like this can tell that the embryos are not implanting because they have abnormal genetic makeup. Now, there are other cases where I say we benefit from PGT, people with sickle cell and other monogenic disorder like cystic fibrosis. Now, you have had or you have seen babies with Down syndrome. Tests like this can ensure that those embryos are not transferred to the womb. In PGT, there are equipment that we use. We use the PCR, we use the sequencer. At Androcare here, the kind of sequencer we use is called a MySeq sequencer. It helps us to get the proper genetic makeup of any embryo that we test in our lab. Biopsy can be taken on day 3 or day 5. If biopsy are taken on day 5, mostly these embryos are going to be frozen, so the woman is not taking the embryo fresh. So in that instance, we might have to delay the procedure transfer. It's not going to be in that fresh cycle. So the sample can also be we have to freeze the genetic sample in a freezer which is at -25 degrees centigrade. This is not a normal fridge or freezer you have in the typical laboratory. Basically, if you can look around, you can see some other important instruments that we use to achieve this purpose. PGT seems simple, but the process is a bit complicated when you come into the laboratory.
Here in Androcare Fertility Centre, we pay attention to details. We dot our I's and we cross our T's to give you the best when you're having an IVF cycle with us. Hence the introduction of acupuncture. This will take us to what is acupuncture. Acupuncture is a complementary traditional Chinese medicine which involves the insertion of very tiny fine needles at strategic points on the body called acupoints. What are the importance of acupuncture in fertility? Acupuncture needles are vasodilators. When they dilate your vessels, it improves blood circulation all over the body. And part of your body are your ovaries and your womb. When there's proper blood supply to your ovaries, we get quality eggs for your IVF. And your endometrium thickness determines a lot for your success in IVF. 2, acupuncture boosts your hormones. When there is proper blood supply, like we know, blood is everything. Everything we do in our body goes to the blood. And when there is proper blood circulation in the body, you're healthy. And general health is important for fertility. Acupuncture relieves stress by blocking the production of cortisol and will help your muscles relax. How is acupuncture done? Acupuncture is done when the client comes in. We'll give the client a comfortable position. We'll make sure they are comfortable. Then we start locating the points on their body where the needles are inserted. There are certain points on the lower abdomen. When we're doing IVF, and when you are doing IVF, we concentrate on the thickening of your endometrium. That's the womb. The womb is the part, that endometrium is the part that holds the baby. And we want it to be very, very well prepared. That's why when the doctor takes you to the theater for your scan, they check how thick the womb is and how the flow, the blood supply to your womb. So that particular lining, there is a place called your CV, the conception vessel. That's where we needle. When we needle these points, it drags blood to the endometrium. We needle other points on your body to support this. We needle the ovary area to supply blood to your ovary. But ultimately, we would ensure that the client is comfortable, in a very comfortable position. This client would stay on the bed for at least 30 minutes while the needle is on their body. And these needles are stimulated to enhance the function of the needle and the nerves. Acupuncture plays a vital role in your IVF cycle. When having an IVF cycle, if you add acupuncture, it takes you from the mark of 50-50 to a better place. Acupuncture is very vital because it thickens your endometrium and prepares your baby, your womb, to receive the embryo. Your womb will be like a magnet because the acupuncture, the blood flow to your womb enriches that endometrium with oxygen, a lot of nutrients. So when your baby comes, it sticks easily, which makes your implantation rate higher, and ultimately you achieve pregnancy, which is the goal. To have an acupuncture section, you will need at least 8 sections. At least 8 sections. When you come in for your IVF cycle, the next cycle you will be having, do not forget to mention acupuncture to your doctor.
Once you have done your egg collection, the eggs are taken to the lab for fertilization. After 24 hours, the embryo is formed, or we can use the word baby is formed. After 24 hours, this is how the baby looks. The embryo looks like this, a 2-cell embryo. After 48 hours, this is how the baby looks, or the embryo is dividing into a 4-cell stage. On the 3rd day, it goes to a multiple form of cells growing. Then on the 4th day, numerous cells are formed within the embryo. This is called the morula. And on the 5th day, we have what they call the blastocyst. See how beautiful it is. And on this day, we would have told you to come for us to transfer this embryo into your womb. So on the day of the embryo transfer, you take water, you drink water so that you are pressed, your bladder is full. This will help me to visualize how to enter your womb, to drop your babies. And once we take you in, we scan you, I'll be given a catheter loaded with your babies. Ideally, we transfer 2 embryos into your womb. The procedure is not painful and it lasts for just 1 to 2 minutes. And I congratulate you and I tell you in 2 weeks' time, you come for your pregnancy tests and hopefully you are pregnant.
After embryo transfer, please note, avoid physical and mental stress as much as possible. Take your drugs as prescribed by the doctor, including your folic acid tablets, and do not stop until pregnancy test. Report to the doctor or the IVF coordinator if you have any problems. Avoid sexual intercourse for at least 2 weeks. Do your normal domestic activities with care. Avoid carrying or lifting heavy objects. Take vegetables and fruits in minimal quantity. Increase pineapple intake, but stop after pregnancy test is confirmed. Eat healthy, avoid alcohol, and stop smoking. Avoid laxative, that is, food or medication that causes frequent stooling. Your pregnancy test is 14 days after embryo transfer.
2-week wait is a time between the embryo transfer and pregnancy test. It's 12 to 15 days. This time, the expectant woman is anxious, she's restless, she's nervous, she's hyper aware of all the sensations in her body. We encourage her to try and relax, to not stress herself, and to resist the temptation of doing pregnancy tests before the time, because this may give false negative results or false positive results. We encourage her not to have intercourse with her husband, as this may make the uterus contract, and we do not want this. We encourage her to use her drugs well as instructed. We encourage her to sleep well, rest, and relax. We also encourage that she should read interesting novels, watch movies to help her relax. Then, the day of pregnancy test, she would use the strip we give at embryo transfer. She will use it to do the pregnancy test, and she will call us or send it to us through WhatsApp. And when we see it and it is positive, wow, the whole center will go agog. We are excited to see such results. We celebrate her. We celebrate and we rejoice. Then we encourage her to continue with her drugs, not to stop the drugs, and we book her for pregnancy scan. The pregnancy scan is to check if the embryos are inside the uterus where they should be, and then the number of the embryos that implanted. At this point, we give her a referral letter to go and start antenatal at a place or a clinic of her choice. Then, those that do not have the desired results, we encourage them. At this point, they will need to stop the drugs they are using, and we invite them to come in to have a review on way forward with the doctor. Doctor will review the past treatments and then plan what can be done to increase their chances of succeeding this time around. And we encourage them. We will never leave them. We keep calling them, send messages to them so that they will know that we are together in it. We feel their pains and we encourage. At the end of the day, they will come back to do their treatment again, because it is not over until they win. That they did not succeed the first time does not mean that they will not succeed again. They sure will. So far, they do not give up.
There are just 2 pregnancy outcomes that can occur after you have finished your IVF cycle. It's either it's positive and sometimes it could be negative. The 2-week wait is the period before you test for your pregnancy. For some people, they get so scared, but I want to encourage that, see, there are just 2 outcomes, positive or negative. If it's positive, we celebrate, we move on. And if it's negative, the world won't come to an end. As long as you are alive, there is hope. We move again, we try again. So do not be afraid of the results. As I said, there are just 2 outcomes, and always think positive. And even if it's negative, we are here to make it positive.
At this level, it is worth saying that the journey to parenthood is gradually coming into fruition, as the outcome of every IVF treatment, if successful, is not just pregnancy, but the outcome of this exhausting but yet pacifying process, which is live birth. After pregnancy test is confirmed, the client is booked for a scan 4 weeks after the pregnancy date. This is to check for the number of fetuses
and their viability. She's then referred to a standard center to continue antenatal care there. During this time, the clinic also checks up on her to ensure she's safe and coping well with pregnancy. It is noteworthy and necessary to counsel clients that every first IVF trial may not resort to pregnancy. They may need to try again to increase the chances of success in IVF. So they should not be discouraged and keep hope alive.
After one's treatment has been completed in our facility, we recommend the use of our lodge. It is a serene environment with a standard power supply aimed at providing our clients with peace of mind and eradicating the stress factor on a day-to-day basis. For more information, you can reach out to us on our website at www.androcarefertilityng.org. We are also available on social media platforms as Androcare Fertility Centre on Facebook, Instagram, and TikTok. We are located at 1B Segun Adekoya Street, Coca Estate, Shasha, Akonjo, Lagos. Book an appointment with us today and call or send a WhatsApp text via 081 800 73995. Androcare Fertility Centre. We make babies come true.